Hello, students. Welcome to Next Level Academy. Step up your career. So today's video is based on questions which has been asked on 3rd Feb. So let's start. So first is Glasgow Coma Scale, GCS. It has 3 components. First is eye-opening response, second is verbal response, and third is motor response. In eye-opening response, we have 4 points which we give, like if the person is not responding to any stimuli, we will give 1, and if the person is responding to pain, like opening his eyes to pain, then we will give 2 points, and if the person is responding to speech, like opening eyes to speech, then we will give 3 points, and if the person is responding spontaneously, like opening and closing eyes is spontaneously, then we will give 4 points. Next is verbal response. It has 5 points. If the person is not responding at all to any stimuli, then we will give first point. And if if the client is making incomprehensible sound, then we will give 2, like moaning sound, murmuring sound. Next is if the patient is making inappropriate words, producing inappropriate words, then we will give 3. And if the patient is answering to our questions in a confusing way, like mm, you can guess that patient is not oriented to time, person, or place, then we will give 4 point. And if the person is oriented to time, person, and place, then we will give 5 points. Next is motor response. Motor response, it has 6 points. If the person is not responding to stimuli, then we will give 1. And if the person is abnormally extend his body, then we will give 2. It is also known as decerebrate posture. Okay. Next is if the patient is abnormally flexing his body, then we will give 3 points. It is also called decorticate posture. Okay. Next is flex to withdrawal from pain. In this, the person will use his limbs to withdraw from the pain, but not able to not able to localize it. Next is if the patient is able to localize the pain, then we will give 5 points. And if the patient is obeying the commands, then we will give 6 points. And best response is recorded as 15. And if the patient is if the patient's response is 8 or less than 8, then it is time to intubate the patient. And for comatose client, the GCS is 8 or less than 8. And the least GCS score is 3. And in GCS score, we use 4 steps. First, we will check. We will go to the patient side and check that whether the patient is responding spontaneously. Okay, and then observe the patient, like if there is weakness of any limb is there, we will observe these things, then stimulate and rate. So we have to use we have to check the respond in, like check, observe, stimulate, and rate. So like if the patient is unable to speak because of swelling over the mouth and obeying the command, so you will not give as V1. You will write their reason that unable to speak because of swelling over the mouth. Because when you write V1 there, it may misguide the GCS score. So you need to be very vigilant while uh, assessing the patient's GCS. Okay, so here is a question for you. When you arrive to the patient's bedside, patient's eyes are closed, but they open when you speak. Okay, here, but they open when you speak to the patient and the eyes does and the patient doesn't respond appropriately to questions asked and says words that don't make sense. Okay. In addition, the patient can't obey a motor command. Therefore, when you apply central stimulus, the patient removes the stimuli. So, here, what is E? First, we'll write EVM. So, E is open when you speak. So, we will give E3. V is says words that don't make sense and patient can't. Patient doesn't respond appropriately to question asked, not responding appropriately and says words. Okay, means inappropriate words. So V3 because here inappropriate word is here. Next is M because the patient when you apply central stimulus the patient is removing the stimuli means patient knows from patient is able to localize the pain and the stimuli. Okay, only then he can remove the stimuli, right? So M5. So what is the total GCS score? 5 3, it is 11. Okay. Vancomycin calculation. A doctor prescribed 2000 of vancomycin IV to be administered in 50 ml of NS to the patient. The label on the vancomycin vial reads as 500 mg, which is in powdered form. And how many ml of medication the nurse will take to make correct dose. Okay. So what we have given with, let's write that. First is desired dose is 2000 mcg, okay, microgram, and the vial is of 500 mg. So for easy calculation, we will dilute this 500 mg in 50 ml of NS. Okay, so 1 ml will give us 10 mg, right? And if we convert 10 mg to microgram, then we will get 10,000 mcg. Okay, so available dose is 10,000 mcg. And what is the quantity? It is 1. Here we have calculated that 1 ml will give 10,000 mcg if we dilute 500 mg of vancomycin in 50 ml of NS. Okay, so we will calculate 2000 upon 10,000, okay, into 1. Quantity is 1, 2, 5, then 0.2 ml. So the nurse will take 0.2 ml of vancomycin from the solution, like from this 50 ml, 0.2 ml, and then add 49.8 ml of NS and then administer to the patient. Okay, I hope it is clear to you. Next is 3% NS solution. Here in the vial you can see that 3% of NaCl is written here and it is a hypertonic IV solution. Okay, and it is used to treat severely symptomatic hyponatremia and hypovolemia. Okay, and it is also used to treat short-term fluid replacement. Next is subcutaneous injection. If you are giving this injection with a big size needle like 24 gauze or 23 gauze, then you need to make 45-degree to the skin to administer the drug in the body. Or you can, if you are using 26 gauze needle of ½ inch, then you need to make 90-degree to the skin to administer the drug. And there are sites of subcutaneous injection, upper arms and outer aspect of the upper thigh and the abdominal area, excluding 2 inches from the navel line. Okay. Next is PROLENE. It is a synthetic monofilament suture and it is used in ligation and general soft tissue approximation. And it is of various numbers like number 1, 20, 30, and 40, and so on. And friends, we will make a separate video for suture because there are vast varieties of suture. Next is MAGILL forceps. This forceps is slightly angled in between, and it is used for nasotracheal intubation and as well as to remove foreign bodies. And you can see it is making hole um, by sides, not in center. Like in other instrument, you will see they make this hollow structure at the center, not at the side. Like this instrument is making the circle at edges. Okay. Next is tongue forceps. It is used to hold the tongue, and it is used to grasp the tongue during surgery so that um, the it prevent the tongue from falling back. Next is pressure back. Here is the meter, and here you press it to inflate the pressure in this bag, and it is used when we want to give saline rush. Then we will insert the saline bottle here and pressure this bag and administer the saline with full pressure. And also, when there is arterial line, you need to make a constant pressure there, and for that you use this pressure bag. Next is neonatal suction catheter. This catheter is used to take suction sample, sputum sample, when the neonate is on ventilator. Next is valsalum. It has a tooth-like of structure at the tip, and it is used to hold the interior lip of the cervix. Okay, so if you like this video, then please like, share, and subscribe. And thank you.